That's why we think about health as opposed to healthcare, and about consumer rather than patient. So in kind of our world, the things that have to be present in order to be successful are really three key ingredients. One is you have to build a great, engaging consumer experience. And to do that, you have to think about fitting into the life flow
Mhm.
of all of us as a consumer. So when we set out, for example, Glenn founded and we backed a company called Livongo that you mentioned early on, where we invested. I served on the board. I stepped in as CFO, just showing kind of our model of how we operate. Um, we were helping individuals with diabetes, but also with hypertension, weight management issues, to basically get a better experience than what they were able to get using the tools that they used already. Many people with diabetes use a glucometer.
Mhm.
Well, oftentimes that is, I say this nicely, a dumb box. And if you remember to bring it with you to your doctor's appointment, the doctor might upload months worth of data, scan it for a minute or two, and then think about some adjustments to make in your medication. But what we imagined was a different environment where all that data, every time you tested, was shared with the cloud, where it could be monitored by smart algorithms to see whether or not you, Lisa, might have a different range of normal blood sugar than me. What's normal for you? And are you trending outside of the boundaries of what's normal? And if you are, let's do things to keep you in range as opposed to waiting until it spikes or drops, which could be really dangerous for your health. And so when you do things like that for people, when they say, wow, like, when I'm testing and you make sure I never run out of test strips, like you're sending them to me before I've run out, and I don't have to go to the pharmacy and get more of those, or you're calling me when you see my blood sugar's too high and I tried to sneak that donut and you caught me.
Mhm.
And that maybe wasn't the right decision to make, but I'll do better with my nutrition because you've given me guidance on what to do. Being there as that partner and that companion in a way that people appreciate and like, that's the first element. Now, if that first element's present, then people will use it more often. So in my Livongo example, we were able to get people to actually monitor their blood sugar more often than what they were doing before they had a service with a coach available to them 24 by 7. And so we were getting more data and more information. Having more information allowed us to make our algorithms smarter and provide better guidance. And so that iterative loop of knowledge was something that provided the consumer with a better experience, but also allowed us to improve outcomes. So that's the second piece of the equation. And the third piece, A plus B should equal C, which is if you have great usage and better outcomes, it should provide a strong return on investment. And so what we saw was that, yes, our outcomes were better. People didn't need unnecessary office visits. They avoided going to the emergency room. They maintained their blood sugar better. They used their medications wisely. And so in doing that, you end up reducing the cost to the sponsor of healthcare.